Thank you for attending. This is the Welcome Back Hospice of Cincinnati Volunteers 2021 Annual Mandatory Education video. This video has three main learning objectives: safety, compliance, and service, and many topics will be covered under each of those categories. It's important that you pay attention as there will be quizzes and paperwork to fill out along the way. So why are we providing and requiring this annual education? First of all, it's a refresher on our policies and procedures. Many of our volunteers, due to COVID-19, have been off duty for nearly 12 months, and we wish to make sure that you are confident in your role as you return to serving patients and families at Hospice of Cincinnati. Additionally, annual education is required by the many organizations that we remain compliant with, including the Joint Commission, Ohio Department of Health, Center for Medicare and Medicaid, the Center for Disease Control, Occupational Safety and Health Administration, the Food and Drug Administration, and the Ohio Environmental Protection Agency. So the first training we will receive is on safety, and this will cover the JCAHO National Patient Safety Goals, COVID safety, emergency preparedness, and workplace safety. Hospice of Cincinnati is a Joint Commission accredited organization, which means that we follow the 5 national patient safety goals of identifying patients correctly, preventing infection, the appropriate use of oxygen, using medication safely, and preventing patients from falling. Identifying patients correctly is the first national patient safety goal. We always want to use 2 identifiers when identifying patients, including checking the wristband. You can also check and ask a caregiver if the patient is nonverbal. HOC approved patient identifiers include the patient name, the phone number, the address, the date of birth, social security number, and facial recognition. Please note that room numbers are not an acceptable method to identify patients. The second national patient safety goal is to use medication safely. And for volunteers, this means not to touch or administer any patient medication in the home, long-term care facility, or inpatient care center. This would include any over-the-counter medications such as Tylenol or Advil. Medication questions need to be addressed only by the case manager or RN, and we ask that you forward any concerns regarding medication to your volunteer coordinator so that they can discuss those with the interdisciplinary team charged with that patient's care. The third national patient safety goal is fall prevention. Hospice of Cincinnati has a fall risk assessment completed for every patient that is reviewed regularly by the nurse. Any patient that has a high score of 4+ is considered a high fall risk, and an individual fall prevention plan is created to keep that patient from falling. In the inpatient care center, we also utilize call don't fall agreements. This means that we want the patient and the family member to ring their call light before they would have the need to arise from the bed. We identify all patient fall risks with yellow wristband and socks, and also a yellow magnet on the door. Our nursing team does hourly safety rounding to ensure that the patients have all of their personal possessions. They need to use the restroom, if they need any type of extra support in prevention of anybody rising from the bed. We also do a no pass zone. So if a call light goes off in the inpatient care center, we would like for you to check on the patient and ask them what they need. You can sit with the patient until the nursing team arises, just helping to reassure them that help is on the way. Additionally, we want to report all falls, whether they're witnessed or not. So if someone falls in the inpatient care center, home care, or long-term care, or they tell you that they have fallen, then you need to report that to the interdisciplinary team or your volunteer coordinator. Oxygen safety is the fourth national patient safety goal. Volunteers are not allowed to handle oxygen or gas canisters, either in the home care, long-term care, or inpatient care setting. Additionally, smoking is prohibited where oxygen is being used or stored. This includes smoking on the use of the patient as well as the family member or caregiver. Finally, canisters should be protected from excess heat. So if you witness a canister that is exposed to a heat source, we ask that you report that to your volunteer coordinator. The fifth national patient safety goal is infection prevention. TriHealth and HOC have a lot of policies to protect you from acquiring an infection in one of our environments. If you'd like to see a full copy of all of the policies, you can ask your volunteer coordinator for one. We also provide training sheets in our admissions folders to help teach our patients and families how to provide an infection-free environment. The biggest thing we ask is that volunteers, patients, families, and team members all use hand hygiene because it is the single most important intervention for the prevention and spread of infectious organisms. We will spend the next few slides talking about our COVID safety precautions. I'd like you to pull from your packet the first document that is titled Always Safety Standards for Team Members and Physicians. The purpose of this document is to educate you on how we have created health and standards to ensure the safety of patients, visitors, physicians, and team members. And there's 4 key guidelines and always safety behaviors related to our COVID precautions. The first always safety behavior is I will always welcome everyone by making eye contact, properly wearing a mask, greeting with a smile, and saying hello. Just because we're wearing a mask doesn't mean that we need to do any less with our hospitality in terms of our warm welcome and our fond farewell to every patient and visitor. There are special do's and don'ts of wearing a mask. You want to make sure that the mask is fitted properly over your nose and underneath your chin and fully covering. You also want to ensure that it is a surgical mask if you are in a patient-facing area, and those can be provided to you at any of our inpatient care centers or by asking your volunteer coordinator. Wearing a mask is required of all team members, volunteers, patients, and visitors to prevent the spread of COVID-19. The second always safety standard is around cleanliness, and it is, I will always focus on building patient confidence in the safety and cleanliness of our department space. Some of the ways that we do that is to provide a plethora of materials to help disinfect surfaces. And we also ensure that the soap, the towels, and the hand sanitizer are always available for guests, visitors, team members, and volunteers to use. We want to alert housekeeping of any concerns that you are made aware of. And we also want to ensure that our department area is a clutter-free space. Anything that's on a desktop needs to be sanitized. And so the less we have open to the general public, the safer we can be and the easier it is to disinfect. Additionally, we want to avoid drinking and eating in public spaces. There are individualized snacks. We no longer do full trays of food to be shared amongst team members, volunteers, or families. And drinking is not allowed in public areas. You need to take a drink if you need to remove your mask or eat in a break area or in a public space, a private space. As previously shared, hand hygiene is the best way to prevent the spread of infectious organisms. So our third safety standard is I will always perform hand hygiene at all the appropriate times, especially before and after patient care. We want you to keep your hands clean to prevent the spread of COVID-19. The majority of volunteers will not be providing direct patient care in situations where they would need to be wearing gloves. So the best thing would be to just continually hand sanitize and hand wash. When you hand sanitize, you want to do that upon entering and exiting any patient room and also frequently throughout the day. And you need to rub thoroughly for 20 or 30 seconds throughout the entire surface of your hands and wrists. Hand washing is to be used when hands are visibly soiled, after, before eating, before and after arriving on your shift, and also before and after patient care. And you want to use soap and warm water, and the key is to scrub for 40 to 60 seconds underneath that warm running water and dry with a paper towel. Physical distancing is especially important in the healthcare environment and part of our always safety standards. We want to maintain at least a 6 feet minimum distance between individuals, except for those team members that are providing care and need to collaborate. We also want to ensure that there's no crowding in entry, registration, or lobby areas, and there are room limits that are posted that we need to adhere to. This includes the elevator, where there's a maximum of 4 individuals in an elevator. Please give preference to patients and families in utilizing these areas first. Also, we have installed sneeze guards or plexiglass barriers at our greeter screener station, as well as at our unit coordinators, and we ask that these be cleaned regularly and that the person that's screening tries to stay behind them as much as possible. Finally, we have staggered breaks, so we wish for our volunteers and our team members to not eat together or utilize the break room together, that they do that at different times and not sit together. And finally, we do have various stickers on the floor that help remind our visitors and others to please mind their space and to stand and wait in a queue rather than crowding, for instance, at the unit coordinator desk, waiting for someone to assist them. Part of our management of COVID-19 patients in isolation has been to institute barriers and clearly identified isolation areas. And volunteers will not be allowed to enter these isolation areas. They are currently all at our Blue Ash Inpatient Care Center. Although some of our care centers may also have isolation patients, we need to just be aware that we're trying to co-locate them as much as possible at the Blue Ash campus. If we do have patients in isolation, there would be a black barrier down the hallway that would say stop, nobody but team members go past this area. And that includes volunteers. We don't want you to walk past the black barriers. Outside each of our patients' room, there are yellow isolation carts that contain all of the PPE supplies that the team members need to enter the rooms. That's another good indicator that a patient is in isolation, and we ask that you stop and not enter those areas. As well, there will be posting of information on the door about the precautions that must need to be taken in order to enter the patient's room. If you are providing direct patient care that requires you to wear PPE, which again will be in very limited instances, we want you to know the correct ways to don or put on and doff or take off your personal protective equipment. The order that you would don PPE is first you would put on a gown, then your mask, then your goggles, and finally your gloves. And then when you take off, you are kind of doing the reverse. So you would take off your gloves first. Here is a graphic about how to take off your gloves so that you are rolling them, where when you pull them off, the inside will now be on the outside. So that way any infectious agents would be sealed up inside the glove. And so you would take off your gloves first, then your goggles, your gown, and finally your mask. Now we are going to review our self-screening procedures. Volunteers will be following the same self-screening procedures as our team members, and I would like you to turn to the second handout in your packet entitled the COVID-19 Self-Assessment Screening. So TriHealth is committed to keeping our patients, community team members, and medical staff safe throughout the COVID-19 pandemic. Stringent safety practices are in place at all locations, and volunteers are required to conduct a COVID-19 self-assessment just prior to leaving home and reporting to duty before each shift. The COVID-19 self-assessment screening includes having access to a reliable thermometer and taking your temperature just prior to leaving home before returning to duty for each shift. You want to observe yourself for fever of over 100.4, unexplained cough, shortness of breath, and difficulty breathing. If you have a high temperature or any of these symptoms, that may be suggestive of COVID-19, you should not come in to volunteer, and you should report these concerns to your volunteer coordinator. The following symptoms are also possibly related to COVID-19 infection. You should immediately discuss these symptoms with your personal physicians. If you develop a fever or worsening symptoms, again, contact volunteer services at 246-9168. These additional symptoms include chills, repeated shaking with chills, muscle pain, body aches, or headache, unusual tiredness or fatigue, sore throat, loss of taste or smell, nausea, vomiting, or diarrhea. You are also required to report to volunteer services if you have been exposed to someone with a confirmed case of COVID-19 or if you have traveled recently. We will take your information and consult with TriHealth Employee Health on the precautions that you must take before returning to volunteer services. We now ask you to pause and complete the reverse side of the COVID-19 self-assessment screening. This includes the quiz and attestation statement. Once completed, you can resume your video. Now we'll move away from infection prevention and focus on other workplace safety reminders. We wish to remind you about the active shooter class you took as a part of volunteer orientation. In the active shooter scenario, we wish to run, hide, and fight. Run is our first choice. If possible, we wish to escape the situation. Hide only if escape is not possible, and fight as a last resort. Your safety is our #1 priority, so we want you to call 911 only when you are safe first. Other workplace safety reminders from your volunteer orientation include a reminder about hazardous materials. We want to be sure that we are clearly reading all of the symbols that are located on any hazardous materials we may be using, such as cleaning supplies. And also, we want you to wear gloves if you're dealing with an irritating or toxic substance, and ask for help. Our team members are always willing to help our volunteers with any type of material that they need instructions on using. Secondly, we wish to remind you about your own fall prevention. We want you to be aware of trip hazards such as cords and chairs and things that may be a hazard to you as you're volunteering. Watch out for floor signage. We have been doing a lot of cleaning in our inpatient care centers, and there are frequently wet floors where there will be a sign posted, so be aware of those. And then if you're volunteering the home care or long-term care environment, please be aware of any icy walkways, and it's asked that those be cleared or take extra precautions or a different route if you are discovering an icy walkway. Finally, we want to make sure you protect your back, that you don't lift anything too heavy, and that if you do lift, you lift with your legs, not with your back. And then finally, watching your posture, not sitting too long in the same spot, not it's just slouching, standing to stretch as much as you find you need to. Fire safety is important in the healthcare environment. When you enter any new location, you should, as a reminder, locate the closest exits, the fire pull stations, any fire extinguishers that are close in proximity to be able to be used in the event of a fire. Also, with fire drills, we want you to participate with the team members, as well as sign the log that you were there and did participate in the drill. There are 4 essential steps to take if you discover a fire. The first of which is to rescue anyone in immediate danger of the fire. Alarm, you need to call for help, either by the phone or by pulling the fire pull station. We want you to contain, do what you can to close the doors and put a barrier between you and the fire. And then finally extinguish if this is a small fire. If the fire can't be extinguished, then just leave the area and close the door. If you need to operate a fire extinguisher, you need to remember the acronym PASS, P-A-S-S, which stands for pull, to pull the pin and release a lock. And then aim the extinguisher at the fire. S for squeezing, squeeze the handles of the fire extinguisher together to release the stream, and sweep from side to side at the base of the fire until it is fully extinguished. If you are on a volunteer assignment and you are part of an emergency, we want you to contact the Navigation Center. That number is 513-891-7700. The Navigation Center can get you whatever help you need, and it's open 24 hours, 7 days a week. If you call the Navigation Center, you need to report your name and that you're also a Hospice of Cincinnati volunteer, the location where you're at, and if you're with a particular patient. We want you to stay with the patient if possible, and if you're in a facility or an inpatient care center, to follow the staff instructions. Particularly in instances of electrical failures, they may need some assistance with helping to plug important instrumentation into the correct backup generator plugs. We do want you to seek shelter if needed, and you can do that in a basement or in a small room. And then finally, listen to the radio or to the local TV to stay updated on any changes. In the event of a domestic situation, if you feel unsafe, we want you to leave, but we want you to leave and call the Navigation Center, again, to report. We could have another volunteer or staff member going to enter that situation, and that information can be vital to their safety as well as to yours. Now we have reviewed all of the safety information. We would like for you to pause the video and complete the next document in your packet entitled the Volunteer Assumption of Risk and Release. This information you signed at volunteer orientation and annually acknowledges that you understand the risks and release for volunteering with Hospice of Cincinnati. Our next area of annual education will cover HIPAA, boundaries, conflict of interest, and CAP surveys. So why is compliance important? HOC is committed to a strong culture of compliance where everyone, be it team members paid and unpaid, such as volunteers, always do the right thing. And this is to help prevent, detect, and correct any issues with care. We have a no retaliation policy when it comes to reporting compliance concerns because we know that any types of reporting that is investigated leads to changes that can create better patient care and outcomes. So what does compliance mean? Compliance is a collection of 4 areas, including the law. We have local, state, and federal laws that influence how we are compliant within our programs. We also have the code, which is the code for ethical and business professional behavior. We also have our policies. We have policies at Tri-Health as well as Hospice of Cincinnati, which must be followed. And then we have Medicare. Medicare has several conditions of participation which help to guide the operation of our programs. The important thing to remember is that if you have a compliance concern for an area such as safety, HIPAA, protection of a patient, or ensuring that we are performing ethically and professionally in our business behaviors, you need to remember that there is a no retaliation policy. And you can contact any or all of the following regarding your concerns. You can reach out to your volunteer coordinator or the volunteer manager. That number is 246-9168. You may also reach out to the HOC Compliance Office. We have both a compliance manager and a chief quality and compliance officer. And you can reach that number through our Navigation Center at 891-7700. Finally, we also have the Tri-Health Compliance Department, and you can speak to any of the compliance officers on their alert line, which is 569-1900. One of the areas we want to ensure that Hospice of Cincinnati volunteers are taking very seriously is HIPAA. HIPAA stands for the Health Insurance Portability and Accountability Act, and this is a federal law that prohibits the unauthorized use or disclosure of patient information. And this type of information is called protected health information, or PHI. It could be included in patients' individually identified health information, and it could be in any form. It could be written, such as a patient listing, or verbal, such as conversations between 2 staff members, as well as electronic and something such as an email. Personal health information may include name, date of birth, diagnosis, status as a hospice patient, and their social security number. We are required to limit disclosure to the minimum necessary information that volunteers would need to do their job, and as well as other staff members, so that we are not oversharing information that is protected health information of a patient if it's unnecessary. HIPAA concerns that volunteers need to be especially aware of is to protect paper documents. If you receive any paper documents such as a patient listing or patient information for your assignment, you need to ensure that those items are discarded into a shred bin and properly secured. We also want to avoid patient discussions in public areas where they might be overheard by other individuals, visitors, or team members. Additionally, we need to respect the diagnosis boundaries. So if a nurse or clinician is not able to give you the full diagnosis of an individual, then they are protecting the patient's health information as a part of the HIPAA. We need to respect that they have those boundaries and that they're following this federal law. We also want to make sure you do not discuss patients' names as well as their status with families and friends, as just the fact that there are a patient with Hospice of Cincinnati is considered protected health information. You may not take pictures or post on social media about patients. You may be able to share the Hospice of Cincinnati Facebook posts with your audience, but we ask you not to make any posts yourself. Finally, we want you to report violations immediately. We need to address any concerns and create action plans surrounding any type of HIPAA violation. Essentially, if you received the information about a patient because of your role as a volunteer, it is considered protected health information, and you do not need to share this. At this time, please pause the video and complete the HIPAA Volunteer Services Agreement as the next document in your packet. You may resume the video once that is complete. Conflict of interest. A conflict of interest is when our personal interests or activities influence or even appear to influence our ability to act in the best interests of TriHealth or Hospice of Cincinnati. Examples of conflict of interest with some volunteers may be promoting a personal business, serving or arranging as a private hire or on the side for one of our patients or families, serving or arranging for someone to serve as a guardian, power of attorney, or representative on behalf of a patient or family, offering referrals or making recommendations for services, research or storytelling gathering regarding your experience as a Hospice of Cincinnati volunteer, accepting gifts or giving gifts, speaking on behalf of Hospice of Cincinnati or TriHealth, and publicly rating or reviewing or sharing your comments and feedback regarding HOC, vendors, and partners. Maintaining boundaries is especially important as part of your volunteer service. You are assigned patients based upon what's called a therapeutic relationship, and it's for a specified scope, time, and conditions of them being a hospice patient that has requested volunteer support, either in the form of companionship, respite care, activities, or vigil support. We do not want you to vary from your assignment or provide an activity for which you were not assigned without permission from your volunteer coordinator. Examples of boundary violations include oversharing of personal details, gifting or receiving, visiting outside your assignments for additional hours or different additional duties, or continuing to visit a patient after discharge from the Hospice of Cincinnati organization and program. CAPS. CAPS stands for the Consumer Assessment of Healthcare Providers and Systems. This is a standardized approach whereby Hospice of Cincinnati and Medicare gather, analyze, and report information to the community and the public regarding our hospice organization. As a result, we survey caregivers approximately 2 months after the loss of their loved one or discharge from the program. And they are asked a series of questions which may include topics such as communication. Did they receive timely care? Were their family members treated with respect? Did they get help with emotional and religious support and with their symptoms? And did they receive training on how to care for their loved ones? They may also include any additional comments that they wish to share. All of these scores are compiled together and reported on medicare.gov/hospice. And we can see how Hospice of Cincinnati ranks in relation to other hospice organizations in our area. It's very important that you understand that you are a part of the patient and the family's experience. And the customer service that you provide is how they complete their survey. So please ensure that you are always providing the best level of customer service to every patient and every family. Because our mission is to create the best possible, most meaningful advanced illness and end-of-life experience, we take very seriously any complaints that may be passed along. We request that you make sure that patients and families feel free to voice their complaints with you. And also, we need to address those complaints as soon as possible. So please report any complaints or concerns that a patient or family member may share with you to your volunteer coordinator. Or if it's an emergency situation, please call the Navigation Center at 891-7700. With regards to service, we want to review a refresher of Hospice of Cincinnati, the Patient Bill of Rights, our serve culture, understanding total pain, veterans, and communication. As a reminder, the Hospice of Cincinnati mission statement is to create the best possible and most meaningful advanced illness and end-of-life experience for all who need care and support in our community. As a review of the HOC distinctives, we have a lot of longevity. We've been in existence for over 40 years and are the fourth oldest in the United States. Our size is quite large. We are the second largest in Ohio, and we serve over 5,000 patients each year. We have 4 locations, our inpatient care centers in Blue Ash, College Hill, Anderson, and Hamilton. We are also nonprofit, and we provide a large number of direct care volunteers to help support our families and patients. The scope of our services is quite broad, including the Goldstein Family Grief Center, Fernside, as well as holistic services such as art, music, massage, as well as a Lasting Wish program, and palliative programs to help those with advanced illness. We collaborate with TriHealth hospitals, including Bethesda and Good Samaritan Hospital, as well as Mercy, UC, Christ, and many other hospitals in our 7-county region. We also are accredited by the Joint Commission and the Center for Medicare and Medicaid. As a refresher on some of our hospice basics, patients within Hospice of Cincinnati's care have been diagnosed with a terminal illness by 2 doctors or nurse practitioners who do not expect the person to live longer than 6 months if the disease would run its normal course. Care is managed by an interdisciplinary team. This team includes the nurse, the doctor or nurse practitioner, social worker, chaplain, volunteers, holistic service members, as well as the state-tested nursing aide. And this team creates an individualized plan of care for each patient. There are 4 levels of care within hospice. Acute, meaning that someone has symptom management that needs to be controlled or monitored. Respite, which is a much needed break for the caregiver. Routine care, which 90% of our patients are in on a daily basis, is offered either in the home or in a place that the patient might call home, such as a nursing home or retirement community. And continuous care is really around-the-clock care at the bedside, typically close to when the patient might be near passing away. Palliative care is an advanced illness program. Patients in palliative care are not in hospice care. It is a medical care to help relieve the symptoms and stress of serious illness. The goal is really to improve the quality of life and provide acute symptom stabilization. We also will address the psychosocial needs of the individual and create goals of care discussion. And the palliative care team will continue to consult with the patient's doctor to help provide more at the bedside support for patients with serious illness. In the last year, we've done a lot with creating our Lasting Wish program. Lasting Wish is about creating joy and meaningful experience for patients in our Hospice of Cincinnati program. And it's about simple wishes usually, and they're funded through donations. Volunteers can recommend wishes for patients that they may discover. In this picture, we have one of our patients who wanted to receive a crowning as Miss Hospice. And so we created a wonderful pageant for her where she was able to receive a sash and a crown. And it was to such a delight. If you want to recommend a wish for any of your patients, please contact your volunteer coordinator. We have continued to expand our Social Connections program over the last year. Social Connections is a non-medical social support program where patients are not an active Hospice of Cincinnati patient. Examples of someone who might be in this program is a client who does not meet hospice eligibility criteria as being terminally ill. Perhaps maybe they're just not ready to sign up for hospice care, or they're seeking aggressive and curative treatment, or they have been discharged from the Hospice of Cincinnati program because they are no longer defined as terminally ill. Patient Bill of Rights and Responsibilities. Hospice of Cincinnati provides every patient and caregiver a copy of their rights and responsibilities. They are also posted in our inpatient care center. The list of patient rights and responsibilities include, but is not limited to, being fully informed about the care that they are about to receive, for our team in delivering care to respect their beliefs and values. They are entitled to personal privacy and confidentiality and to have choices in their care. Additionally, patients and caregivers have a responsibility to provide a safe working environment for our team members and volunteers, to provide information about their care and be forthcoming about things they may be experiencing or need to report. They need to treat their team members with respect and ask any questions or for clarification on anything they're misunderstanding, and to follow the instructions as indicated by the plan of care. As a refresher, always behaviors were covered in your volunteer orientation, but is something we wish to revisit and draw your attention to. Always behaviors are a code of conduct for volunteering within Hospice of Cincinnati and Tri-Health. Always behaviors can be defined under 5 general categories that stand for serve: service, excel, respect, value, and engage. Please pull out this information in your packet and pause the screen while you review and read each of the always behaviors as a refresher for how your conduct is expected to be while you are volunteering at Hospice of Cincinnati. As a reminder to set the right tone with every patient and family interaction, we require you to use "Aid It plus the promise." This includes when you are introducing yourself to a new patient. We wish for you to acknowledge them by saying hello, good day, introducing yourself. My name is Lori. Describe what you're doing. I am a part of volunteer services. Explain. Explain what you will be doing. I will be visiting with you for about 30 minutes. Thank them. Thank you for sharing this time with me. I promise we'll have a good time getting to know each other. Because our patients are experiencing end of life, we need to remember that pain has many different dimensions. We call this the total pain model. It means that not only will they have physical pain that may be caused by treatments or medications or some of the causes of their end of life, but it can also have psychological pain, which may include anxiety or past experience of illness or fear of suffering and depression. Pain can also be spiritual, where they're angry maybe at God, or they have a loss of faith or a fear of the unknown. And then finally, social, a loss of identity, a loss of job, a loss of role and social status, and maybe worried about financial concerns or about the future of the family. Often pain is a part and wrapped all together in several different dimensions to create total pain in the patient. Veterans are a very important part of the Hospice of Cincinnati program. As part of our We Honor Veterans program, we provide specialized service to veterans that's consistent with our mission as well as with their need for support. Veterans represent approximately 1/4 of the patients that we serve, and we see them from both peacetime and wartime, many different conflicts, including the Vietnam War, the Korea War, and the Gulf War. And we need to keep in mind that veterans have very different feelings on the military service, and that there was a significant impact and lifestyle on the family when the veteran was serving. Many rituals and symbols can have important meanings for patients. They could be good meaning and they could be negative meanings. And that each war had its own trauma. And so what we try to do is we try to match veterans with other veterans from a similar experience so that they can have that shared experience and talk together to process end of life. As a reminder, in communication and building a wonderful relationship with a patient, step one is always active listening. We want to learn more about the patient before we engage with any type of conversation. And asking questions and listening to their responses can really help us to get to know someone. To be active listening, it's not just about hearing what they're saying, it's about paying attention. It's about suspending your own judgment. It's about reflecting and really letting what they say sink in. Also, clarifying, asking clarifying questions, summarizing by saying things like what I heard you say and what I think I heard you explain was, and then also sharing a little bit about yourself and how you relate helps to build trust and a togetherness in the relationship. Diversity is very important to be mindful of when providing care to hospice patients and families. And we define diversity at TriHealth as a variety of characteristics, visible or not, that distinguish one individual from another. These characteristics, including the visible ones, might be race or gender, physical ability, or age. Things that are not so visible, but may be still very, very important, could be their professional experience, their social class, which side of town they live on, their personality traits, their background, and their work experience. As a refresher, as a volunteer, you have many rights and responsibilities, just like patients have rights and responsibilities. Your right is to know our mission and values and to receive training as you need it before accepting any role within the volunteer program. You should feel supported if you run across challenges by your volunteer coordinator and volunteer department. You should feel like you're receiving regular communication and are well informed about updates regarding Hospice of Cincinnati and the volunteer program. You have the right to change a role if you feel that it's not what you really want or are enjoying doing. You also will receive feedback on how you're performing, and you have the right to decline assignments if it's not something that you really want to do or you're just not jiving with the patient that you're assigned to. We always want you to ask questions, and we're there to provide thoughtful and constructive answers. Responsibilities, we want you to be patient-centered. There are many reasons why people volunteer, and we know that those are important. Could be for school, for experience, for the social connection. What we want and ask you to do is that you always keep serving patients and being patient-centered as the number one reason why you're here. We also need you to follow our policies. We will help to guide you in those policies and educate you, receive training on how to implement them. We also need you to communicate with us. If we need to reach out to you, we need you to respond to our calls or emails in a regular and timely way. Also providing timely documentation about your service, both in terms of meeting with patients as well as service for other projects. We also need you to attend continuing education. That will be offered on a monthly basis, and you may choose to enjoy that. We certainly will let you know if something is required for your particular role. At this time, please pause and complete the annual mandatory education quiz and the marketing and communications authorization. The authorization form has two sides. Please remember to sign the back. Thank you for receiving this annual mandatory education from 2021. We are excited to welcome you back to volunteering, and we also thank you for your service to our patients and families. If you ever have any questions, please contact the volunteer office or your volunteer coordinator, and we'd be happy to answer those to you. We do ask that you now take your information and return any signed copies of paperwork to your volunteer coordinator so that we can file those and show that you are compliant with your service as a volunteer. Thank you and have a wonderful day.